All right, so here is, am I saying this okay here on your, is it focus and all that?
Yeah.
Okay, we have a good occlusal surface, lots of excess, and a big whopping void right here on the inside there. Margin's not too bad, but I don't like that void. And when I go to try to fit it on here, as often happens, it doesn't even go on because we have lots of interferences. So I'm going to reline this, and relining is something I almost always want to do for 3-inch bridges, or actually anything more than a single crown. Almost always a reline. So let's show you how we prepare this for a reline. Alright. First thing I'm going to want to do is take off all this excess that's keeping this from seating. So let's just go around here. All this overhanging stuff. Now I'm not really terribly worried about my margins because I'm going to reline it. So if I blow past my margins, as long as I don't blow too far past, it'll be fine when I reline it. I just want this to seat. I don't want it to get hung up on the adjacent teeth. I don't want it to get hung up on the gums. Of course, in a patient's mouth, you're going to have gloves on. Obviously, this particular model I know has no infectious diseases, so I'm good. I'm taking some off the contact too. I just want it to seat. Now, here's the really critical part. You want to get the inside completely relieved. Well, there's a big void there too. I don't care about the fit here. I don't want a little tiny bit of relief. Bore it out.
Okay. It's good.
Okay. Okay, now I've just made a hole in the surface here, but I don't care because I'm going to reline it, it's going to create that whole surface again. So, just completely get the inside reamed out. So that when you put it in the patient's mouth, let's see if this air syringe works here. And you don't have to follow me every time I move it to the end. It's going to stay in the same area. I'll try to keep my work area the same.
If I hit something to zoom in.
Yep. There's a thing on the top there, over here. This is your telephoto wide angle right there.
Okay.
Yeah, so you can go wide or zoom in.
That's good right there. Okay. That's good.
Okay.
Let's focus.
Alright, so let's see if this fits on here now. Ooh, a lot better. A lot better. Alright, so that's back in the patient's mouth, but my margins are crummy now. So let's make another mix, and then I'm going to place it in here and we're going to reline it. Okay, you can pause again. Are we live?
Yeah.
Okay, so I relined it, I put some stuff in there, and I'm squishing it down nice and firmly. And now my finger just pulled the stuff out of that hole. If you see any voids at this point, while the material's still soft, just lay it on top. Now have the patient bite down. That's pretty good. Now look at the bite right here. Looks like they're biting in a good place. The reline procedure will help you adjust some of the bite discrepancies, because if you hollowed out the inside, let's say it's a little bit high, and you hollow it out, it'll seep down a little bit more, so that when you reline it and they bite down, it'll settle down a little further, and it'll save you some adjusting time. So not only will it improve the fit, it'll save some adjusting time. Now I'm going to let this set. Once again, I'm going to check to make sure that so that it's not setting too quickly and it's going to lock in. Now the trick here is to tease this on and off as it's setting. So we take a curved hemostat, and I'm going to still let it get a little bit rubbery, and then I'm going to grab it, and I don't want to pull it all the way off, because if I pull it all the way off, I'll not get it back on again. And as soon as it gets a little rubbery, I'm going to just pull it up enough to break any bond that's there. pause it again, so I have to wait. Alright, are we live?
The facials is just the front part. Would you like to see a mirror?
Got it.
Okay, so now I'm going to take it and I'm going to just gently tease it up. Okay, see it moved? That's fine. Push it back down. Back one. It moved. Great. Seat it back down. Have the patient close again. Make sure it's fully seated on there. Keep checking. And then as it continues to set, I'm going to alternate, lifting it up and down, pushing it back down. Now, as I'm teasing it and feeling it, as soon as I feel that it's starting to lock in any way, then I'm going to take it completely out. I don't want it to lock in. I'll deal with some distortions, but I don't want it to lock in. But if it's not locking in, I'm going to just keep doing this and try to let it set in the patient's mouth if it's not getting too warm. And this is not going to get as warm as the first time because you just have a thin layer of material. Notice this spot over here where the hole was. It's kind of ugly, but it's in correct occlusion. So I'll just got to make that look pretty, but I know my occlusion is going to be all right. Alright, let's try it again. And down. Okay, you can pause that.